Welcome to our comprehensive guide on the HealthTrackRx Wound, GI, and ENT menus. In this video, we'll explore the various panels available, the specific symptoms each is designed to address, and the pathogens they detect. Our goal is to provide you with a clear understanding of how these targeted tests can enhance patient care through precise and efficient diagnostics. HealthTrackRx syndromic menus were designed in collaboration with infectious disease physicians to help providers only test for pathogens directly relevant to their patients' symptoms. This approach limits over-testing of microorganisms not pertinent to the patient presentation and ensures providers only detect and treat what is medically relevant in each patient's case. HealthTrackRx offers 3 GI menus differentiated by the clinical indication to test each grouping of pathogens. The diarrheal disease menu includes many bacterial and viral causes of acute gastroenteritis. This specific subset of pathogens includes several bacterial pathogens that may have an indication to treat, and 2 viral pathogens associated with significant public health concern. For patients with prolonged gastroenteritis symptoms, the protozoal pathogens can be added on for additional testing through a single add-on code. Obtaining a stool sample from a patient can be difficult, so both stool samples and rectal swabs are accepted for this panel. The Traveler's Diarrheal Disease menu includes a combination of bacterial and viral causes of traveler's diarrhea, commonly acquired through ingestion of contaminated food or water. Like the diarrheal disease panel, the protozoal pathogens can be added on when the patient has had persistent gastroenteritis symptoms. The HealthTrackRx Pediatric Diarrheal Disease menu allows for testing of communicable pathogens commonly associated with daycare transmission. Each of our GI panels allows for inclusion of protozoal causes of diarrhea when it is medically indicated to. The Superficial Wound panel tests for common bacterial pathogens associated with impetigo, MRSA, and several pathogens that can cause more serious skin infections. This panel also includes the option to add on viral causes of superficial infections, including varicella zoster virus, HSV, and Mpox. The Deep Non-Healing Wound menu tests for many of the same bacterial organisms as the Superficial Wound menu, but includes additional organisms that are relevant when there is wound tunneling. This includes additional skin flora and anaerobic bacteria. This panel is appropriate for diabetic ulcers, tunneling wounds, abscesses, cellulitis, or chronic wounds that aren't healing despite antibiotic therapy. HealthTrackRx also offers a tinea menu for cutaneous fungal infections. A tinea infection can sometimes cause confusion as to whether it is caused by fungal or bacterial organisms. This menu will help differentiate between these infections. When there is concern of a fungal nail infection, the onychomycosis menu offers testing for bacterial and fungal causes. The affected toenail or fingernail can be submitted for processing by placing directly into our specimen collection tube. The otolaryngology menu covers more complicated and chronic ENT presentations. While there is some overlap with our respiratory menu, it is not intended to test for acute respiratory infections and should be reserved for patients with complicated ENT infections. Finally, our ophthalmology menu offers testing for bacterial, viral, protozoal, and fungal causes of external eye infections, such as corneal ulcers or keratitis.